Hello. Selective laser trabeculoplasty, or SLT, is a procedure used to treat glaucoma. Glaucoma is caused by high pressure in the eye that damages the optic nerve connecting the eye to the brain. SLT uses a low-energy laser to target the drainage channels in the eye. It isn't completely understood how this works, but it allows fluid to flow through the channels better. This reduces the pressure in the eye and helps to preserve your current vision. Studies show that SLT on its own was enough to control eye pressure in 3/4 of patients for at least 3 years. In these studies, some patients responded well to the treatment, while others did not respond at all. Usually, we cannot predict how well the laser will work. This is because your response is determined by the type of glaucoma you have and the basic structure of your eye. SLT is now often recommended as the first treatment for newly diagnosed patients. It can also be used for patients who are unable to use glaucoma eye drops. SLT is often used alongside other medication, helping to lower the pressure in the eye even further. Remember, SLT is performed to save what sight you still have. It will not restore any eyesight that has already been lost, and it is not a treatment to improve eyesight. Immediately after the treatment, the pressure in your eye may increase. You may also have some inflammation. In order to prevent this, we put in special drops when we treat you. We may also provide anti-inflammatory drops. Occasionally, we provide extra glaucoma drops following your treatment. Very rarely, the pressure in the eye will rise very high and not come down. If this does happen, you might require surgery to lower the pressure. However, please be assured that this is a very rare occurrence. If you decide not to have SLT, please discuss the other treatment options with a member of the ophthalmology team. Remember, if your glaucoma is not well controlled, you could suffer from high eye pressure and loss of vision. SLT is usually carried out in an outpatient clinic. An ophthalmology team member will take your written consent, providing an opportunity for you to ask any questions. A nurse or technician will check your vision. They will put some drops in your eye to prevent the pressure from rising, and some to make your pupils small. These drops may take up to an hour to work and cause a temporary headache. You will then be asked to sit at a machine similar to the one where you had your eyes examined at the eye clinic. This machine is attached to a special laser. Anesthetic drops will be used to numb the front of your eye. The doctor will place a small contact lens onto your eye. This allows them to have a really clear view of your eye. During the laser treatment, you might see some flashes of light and hear clicking noises. Most patients find the laser treatment painless, but some might feel slight discomfort. The treatment usually only takes about 5 minutes per eye to complete. Once the treatment is completed, you'll be asked to return to the waiting area. About 1 hour later, your eyes will need to be re-examined to check the pressure. We will then make an appointment for you to come back to the clinic, usually 1 to 2 weeks later. This follow-up appointment is to check that your eye is settling, although the treatment may take up to 8 weeks to work. After the procedure, it is normal for your eyes to be red and feel a little sore and irritable. Simple painkillers can help, and symptoms shouldn't last longer than 24 hours. Don't be alarmed if you notice that your pupils remain small for several hours. This is because of the eye drops. Your eyes should be back to normal the following day. You should not drive yourself home after the procedure, therefore you should make the necessary transport arrangements. Use the contact details provided for advice, or if your symptoms continue for more than 24 hours. Ask your eye specialist about local accessible support groups. For example, you could contact Glaucoma UK to find out what support is available. They are a fantastic charity offering support and advice for people living with glaucoma.